Happy New Year, fellow future RNs! 2024 na! Handa na ba ang lahat na maging top-notcher at makareceive ng lisensya nila this year? Tayo na yan, this is our year, so i-claim na natin. Dahil dyan, umpisahan natin ang ating taon ng isang study hack. So today, we're gonna be talking about Parkinson's disease kasi naman siya na lang yung naiwan. Diba last year, we already talked about MS, MG, GBS, we even talked about stroke. So si PD na lang o si Parkinson's disease na lang yung naiwan. Kaya naman, pag-usapan na natin siya today. Let's go! Parkinson's disease or PD is a degenerative disease caused by the depletion of dopamine, which interferes with the inhibition of excitatory impulses, resulting in a dysfunction of the extrapyramidal system. It is a slow, progressive disease that results in a crippling disability. Okay, ang debilitation can result in falls, self-care deficits, failure of body systems, and depression. It is also important to remember and to note that mental deterioration occurs late in the disease. Okay, balikan natin yung cause ng Parkinson's disease. The depletion of dopamine. Okay, kung naalala nyo pa yung ating dang-samad. Dang-samad. Diba? D is for dopamine. And kapag increase ang dopamine, is schizophrenia. Okay. Kapag naman decrease ang dopamine, anong pwedeng meron? Parkinson's or our PD. Okay, so that's why kapag Parkinson's, decrease ang dopamine. Okay, so ano nga ba to si dopamine? So, kung naalala nyo, dopamine is a neurotransmitter. Okay, it is a chemical messenger. In other words, dahil siya ay chemical messenger, tinutulungan niya yung mga neurons na mag-communicate. Okay, so ang ating dopamine has several vital roles in our body. Marami siyang functions. Okay, meron siyang role sa ating movement, number 1. Okay, meron siyang role sa ating movement. Dopamine has a key function in controlling our movements. It is a part of the basal ganglia motor loop in the brain. Okay, another. Ang ating dopamine ay may role din sa ating reward, pleasure, and motivation. Okay, another is sa ating cognition. The dopamine helps control the information flow of memory, attention, and problem solving in the frontal lobe of the brain. Okay, another is sa attention. Okay, may role din dyan ng ating dopamine. It helps in focus and attention. Another is sa sleep regulation. May function din dyan ng ating dopamine. It helps regulate the circadian rhythm or yung ating body clock na tinatawag. And another, meron din siya sa psychosis and addiction. Again, maaalala natin kapag madami ang dopamine, pwedeng may schizophrenia. Okay? Also, marami pang mga physical na function ang ating dopamine. Meron din siya sa digestion, etc. Okay? So, remember the functions and the roles of our dopamine. Okay, tandaan natin kapag Parkinson's, ano yung ating dopamine? Down. Okay, let's remember that. Okay, so, ano yung mga possible na signs and symptoms? Unahin natin yung mga commonly na lumalabas or nababanggit na mga signs and symptoms when it comes to Parkinson's disease. Okay, first, bradykinesia. Okay, brady means slow and kinesia pertains to movement or motion. So bradykinesia or abnormal slowness of movement and sluggishness of physical and mental responses. Again, kanina na-discuss natin may role ang ating dopamine sa movement ng ating body. Okay, so may bradykinesia pag may Parkinson's disease. Next, tremors. Okay, tremors in hands and fingers at rest. Okay, ang lagi nating makikita or usually makikita, ang characteristic is the pill rolling tremors. Pill rolling tremors. Okay, the tremors increasing when fatigued and decreasing with purposeful activity or sleep. Okay, next, rigidity. Rigidity with jerky movements. Yung characteristic naman yan na usually makikita natin is the cogwheel rigidity. Okay, next na common din is the blank facial expression or ang ibang term dyan is the mask-like face. Okay, next is the shuffling steps or stooped position and propulsive gait. So, shuffling, short, stepped gait. So, yan ang mga common natin when it comes to the signs and symptoms of Parkinson's disease. Other signs and symptoms include your monotonous speech, handwriting that becomes progressively small, restlessness and pacing, drooling, difficulty swallowing and speaking, and loss of coordination and balance. For nursing considerations or interventions, first, of course, we assess the neurological status of the patient. We assess the ability to swallow and chew. That's very important. Kasi kanina nabanggit natin sa signs and symptoms, pwedeng merong difficulty of swallowing. Provide high calorie, high protein, and high fiber. Soft diet with small, frequent feedings. Increased fluid intake to 2,000 ml per day, of course, as ordered. Kasi nabanggit natin ang ating dopamine has also something to do with digestion. So, kapag masyadong konti ang dopamine, pwede mag-constipate ang ating patient. That's why we monitor for constipation. Another one is to promote independence along with safety measures. Kasi affected no ang movement, ang gait ng ating patient. And also avoid rushing the client with activities. No, kasi may rigidity, may bradykinesia, may slowness ng movement. So avoid natin i-rush ang ating patient kundi mag-frustrate sila. Okay, next, instruct the client to rock back and forth to initiate movement. Instruct the client to wear low-heeled shoes. Of course, hirap na maglakad. Mas safe kung low-heeled shoes. Encourage the client to lift the feet when walking and to avoid prolonged seating. Provide a firm mattress and position the client prone without a pillow. This is to facilitate proper posture. Kasi stooped posture ang ating patient with Parkinson's disease. Instruct in proper posture by teaching the client to hold the hands behind the back to keep the spine and neck erect. Kasi 'di ba parang nakakuba sila? Instruct natin yung patient na ilagay yung hand nila sa likod para mapanatili no yung naka-erect yung spine and ang kanilang neck. Para hindi laging parang naka-forward ang posisyon ng ating patient. Administer anti-Parkinsonian medications to increase the level of dopamine in the CNS. So, madaming medication na binibigay, pero yung usually or yung common na naririnig natin is the carbidopa, levodopa na medication for Parkinson's disease. Pero maraming binibigay, nagbibigay ng anticholinergics, nagbibigay ng mga medications that increases the dopamine, just like your amantadine, etc. Instruct the client to consult with the doctor regarding the foods high in vitamin B6, or that's your pyridoxine, because they block the effects of anti-Parkinsonian medications. Okay? And lastly, avoid the use of MAOIs or your monoamine oxidase inhibitors. Why? Because they will precipitate the hypertensive crisis. So that's all for Parkinson's disease. Thank you so much for watching this video. Please subscribe to my YouTube channel, and meron din po akong Facebook page at Nursing Study Hacks. Thank you so much. I hope you learned something today. Bye!